The focus for this week's class is professional and social advocacy and clinical mental health, and we're going to pay particular attention to policy as it relates to mental health and advocacy. As you read in your textbook, the American Counseling Association adopted advocacy competencies to express just exactly how important it is for counselors to have the knowledge and skills needed to be able to advocate for the profession and for clients. And so this box illustrates the different domains of advocacy competencies. And for the purpose of this PowerPoint, we're going to focus primarily on social and political advocacy. Before we get into social and political policy and advocacy, I'm going to talk a little bit about, as you note in the cube above where I've circled what we're highlighting today, the public information area, because it's often public information that leads into something changing at the policy level and the advocacy efforts at the policy level coming to fruition because of good advocacy efforts on the public information part. So I wanted to start by giving you the example of germ theory and public health campaigns. Historically, there wasn't just common knowledge that there were these invisible microorganisms out there that were called germs and that they could make you sick, but we had to have a public health campaign to raise awareness about the need for there to be hand washing and for people to drink clean water and to store their food and refrigerate it properly, to dispose of waste through plumbing, to get kids vaccinated, and to use antibiotics properly. So all of that information is pretty much common knowledge now. Most daycares require hand washing of children as soon as they come in. Most people leave the bathroom in a public place and wash their hands before they go. Everyone understands the value of clean water, and there's bottled water and all different levels of cleanliness related to your water everywhere. Schools require now that you certain vaccinations when coming in. So there is a lot of regulation at the policy level that goes into making sure that all of these things that will help us to be a healthier community and society are implemented. So some people ask, well, can a similar public health movement be helpful to mental health? Can something that's happened related to the idea of getting the public to be informed about germ theory, is there some kind of corollary to mental health that might be helpful? And some big things that we would like the public to have a better understanding of are the causal factors of mental illness. What causes mental health problems? A long time ago, people believed that what caused mental health problems was poor character, a lack of morals, being punished by a god, but we've become much more sophisticated in what we know, and there's still a lot that we're learning, so we want to be able to figure out how do we spread this information publicly so that people are more aware of how there are different risk factors, but that there are also protective factors that can contribute to good well-being. So we know that some of the risk factors are genetic vulnerability. Some people are just predisposed to being kind of hardwired to be more likely to have anxiety, depression, schizophrenia, and so forth. We also know that toxic stress, exposure to toxic stress and trauma will kind of light off one of those genetic predispositions or create a mental health issue even among people who were not genetically predisposed to have a mental health issue. So toxic stress and trauma are really big risk factors that we need the public to understand more about. The protective factors are the personal skills and resources that counselors can help people to develop, but also that people can develop for themselves by making certain lifestyle choices. And then we know that there are environmental buffers, such as education and infrastructure that supports social engagement, playgrounds in a community, safe neighborhoods to walk around in, community places where teenagers can go and hang out and have a good time without getting into trouble. These are kind of some of the environmental buffers that help as people are wanting to grow and develop and learn, help them to be protected against mental health issues. The general theory of what causes mental health issues or mental illness is depicted here. So it starts with a genetic vulnerability or has the potential to. You combine that with stress and trauma in a toxic environment, such as chronic lifelong poverty or being around abuse. And then you end up firing off these different types of chemicals in your brain and reactions in your brain, and it leads to a behavioral health disorder. The behavioral health disorder can end up compromising a person's academic achievement and their ability to form friendships and function socially. Well, then that leads to less of a prime or optimal entry into the workforce, and so quality of life declines. There's diminished socioeconomic status, health status, and developmental chronic illnesses. People who have mental health issues are more likely to develop chronic physical illnesses as well. So all of this kind of creates a more toxic environment because this is all very stressful and creates trauma situations that people with mental health issues might be exposed to. Well, and then that kicks into the brain again and just reinforces the cycle and makes everything even worse. So this is an example of the type of theory that we want to get out into the public. And if you're working in the online unit this week, then one of the things you're asked to do is to talk to another person about some of their preconceptions about how does counseling work. And so where in this cycle, might somebody benefit from counseling services, and how does a counselor kind of intervene to break this cycle? It's important to know what toxic stress is in this model, and it's defined here for you. I'm not going to read it. You can hit pause and read that for yourself, but stress is not to be underestimated, not to be given less attention than it needs. It needs a lot of attention. When we're working with clients and we're thinking about our own types of stress that we have, we really need to develop good coping skills for dealing with stress and finding ways to release stress, because there are many mental and physical illnesses that are related to toxic levels of stress. For example, the ACE study here identified that when people had been exposed to 4 or more categories of childhood experiences were compared to those who had none, then they found that, so this would be people who grew up in a childhood environment where they were exposed to higher levels of toxic stress and potentially trauma in their childhood. They had then a 7.4-fold increase for alcoholism, a 10.3-fold increase for drug abuse, a 4.6-fold increase for depression, 12.2-fold increase in suicide attempts, 2.2-fold increase in heart disease, and 1.9-fold increase in cancer. Results like this indicate that an environment during childhood that contains a lot of toxic stress has lifelong implications for how a person moves through adulthood. You can score yourself and see what kind of a toxic environment that you maybe were exposed to as a child. I have a link posted here, and I will also have the link posted on Blackboard. So one of the unique things about working with public health and advocacy and policy related to mental illness is that there's a lot of stigma in talking about mental health issues. And as you can see from this cartoon here, when we break a bone or we get a bad cut or we get the flu, we have social norms in our society that make it okay to talk about those things. But when we have a mental health issue, sometimes people don't want to talk, they don't know what to say, and so there ends up being a lot of stigma of people thinking I shouldn't bring up that I have a mental health issue because it will change the way that others think about us. What does end up happening, though, is that sometimes we have these tragedies in our society where someone with a mental illness commits a violent act, and then mental illness gets a lot of attention in the news and the media. But the downside of only talking about mental illness after tragedies is that we tend to miss earlier warning signs for people because we're just focusing on that the most extreme types of behaviors. And it's much, much easier to intervene with a mental illness on when you're dealing with early warning signs than when you have a full-blown episode or a horrible situation such as one of these tragedies of violent shooting or something. Talking about mental illness only after a tragedy can also make people afraid to ask for help because they don't want to be associated with someone who's violent. And it spreads a general fear among the public that those who have a mental illness should be feared and that they have the potential to be violent. Statistically, we know that people who have a mental illness are more likely to be victims of violence and not actually perpetrators. So we need to keep talking about mental health, and we need to keep talking about mental illness even beyond when there are moments of tragedy in the news. One of the things that research has done has been to try to measure how much public perception of mental illness has changed. And so there have been studies done since the 1990s to kind of tap into how it has changed, and we'll take a look at those. One of the claims is that depression or mental illness is a disease like any other. It's a disease like diabetes. It has to be maintained, and there might be medication and treatment and lifestyle changes, but really no one is any more at fault or to blame for having a mental illness than they are to be faulted for having diabetes. So some of the things that people say in contrast to that, though, are that it's really not like diabetes because of all of the stigma that we just talked about on the previous slide. There's much less stigma in the public for diabetes than there is for mental illness. So yes, there maybe are some similarities in the nature of an illness that we can relate to diabetes, but the way the public perceives and treats mental illness is much, much different than how the public perceives and treats diabetes due to stigma. So changes in public perception of mental illness have led to increased support for services, but no decrease in stigma. And the neuroscience campaign that has been big going on since the 1990s was seen as a way to reduce stigma by demonstrating that mental illness is a real illness and it's not the result of having bad morals, bad behavior, or growing up with bad parents, that there's more going on there than just a person's choices. So neuroscience has gotten a lot of attention, and that has shaped the way the public perceives mental illness and has been part of that public information advocacy cube in the earlier slide. Another area where the public has received a lot of information about mental illness has been through pharmaceutical commercials. You can click on the link here for the Zoloft commercial, one of the original Zoloft commercials to air on TV, and you can see that people started to get information marketed directly towards the public from pharmaceutical companies that provided additional information about the nature and course and possible treatments of mental illness. Of course, it wasn't intended to be a public information advocacy campaign. It was intended to sell medication, but it had a result of also spreading information. If a public health campaign is going to work with mental health, then we need to have the public's attention, and we need to understand what the public is thinking. So these are two studies, the 1996 study and the 2006 study, that we can compare and see, well, since we've had more talk about neuroscience and more pharmaceutical commercials going on, what changes, if any, have there been in related to the public's perception of stigma? And what we find is that in looking at these surveys from 1996 to 2006, despite all this information about neuroscience, despite all this information coming from these pharmaceutical companies in the commercials for anti-anxiety medications and antidepressants, that stigma in the American public appears to be relatively fixed. We're getting more knowledgeable and we're having more awareness, but the stigma is still in place. And something that we really need to be concerned about is that when the public links mental illness to violence and dangerousness, they are more likely to support resources for the mental health system, but they are also more likely to support social distance. So we see the public thinking, yes, let's provide funding to people who have mental illness, but let's not get too close to them.